In today's Wellness Wednesday, we're wrapping up American Heart Month by taking a closer look at something you might not think of when it comes to your heart health, your oral health. Joining us with more is Dr. Ernest Mishak-Hart, Dental Director of Terry Riley Health Services in the Treasure Valley. Good morning, Doctor. Thanks for being here.
Morning, Matt. Thanks for having me.
Of course. So, a big question. What is the link exactly between heart and oral health?
So that's a great question. And when you talk about heart health, you're talking about inflammation in your blood vessels and things getting tighter. And with oral health, we're really talking about a similar process, which is gum disease and your gums getting inflamed. And a lot of times the germs which can lead to gum disease can also cause inflammation in other parts of the body. So we are trying basically to lower the amount of inflammation in your mouth. And a lot of times that will help keep your heart and your cardiovascular system working well. The American Heart Association and the American Dental Association have often shown that many times folks who have a lot of gum disease or oral disease are at 2 or maybe 3 times at more risk for getting heart disease.
Wow, who would have thought? All right, and what are some of the ways to prevent gum disease and, of course, potentially heart disease?
So first of all, I think we've all heard it before. Make sure you brush and floss daily. Taking care of your oral hygiene is really important. Using a good mouthwash can be helpful for some folks. Seeing your dentist regularly, especially these days with everything that's been going on, it's important to know that going to your dentist regularly is an important thing. For some folks, that may be once a year, but for some folks, up to 3 times a year or 4 times a year, every 3 months can be what's needed to keep your mouth in as healthy as a condition as possible.
Gotcha. Now, how about community members without insurance? How do they receive care?
So, here at Terry Riley, we are focused on trying to provide services for all patients. We also have the ability to provide services for folks who maybe aren't insured or are struggling to, make ends meet. If you qualify, you can be able to access a sliding fee scale for services. We have clinics all the way from Boise out to Homedale. And I would just encourage folks to, go on our website, www.trhs.org. And you can find some access to information about how to access care if you're uninsured or underinsured. And if you're also needing some help about information about how to take care of your teeth, the ISDA has a great website with tips and also how to find a dentist. And that website is www.theisda.org.
Gotcha. We have about 30 seconds now. We're still in a pandemic. What are some of the safety measures being taken at Terry Riley exactly?
So it's important to remember that oral health is essential care. So this is not the time to neglect or put aside, taking care of your oral health. We are staying in touch with all the guidelines and recommendations from the CDC, making sure that we're keeping our patients safe. And so when you go to your dentist, whether it's Terry Riley or elsewhere, things may look a little different. We may have a few more personal protective gear. You'll probably be screened before coming in. But our goal is to make sure that patients are staying safe and that our teams are safe as well.
Perfect. And last quick question for you. You already mentioned the website. Can you just throw out Terry Riley's website one more time?
Sure. It's www.trhs.org.
All right. Easy enough. Joining me this morning has been Terry Riley Health Services Director or Dental Director, Dr. Ernest Mishak-Hart. Thanks so much for being here, Doctor.
Thanks for having me. Have a great day.